What's going on, everybody, and welcome back for another episode of Triggered. This is Triggered episode number 166, coming to you again from the Townhall bunker.
Yes.
We're here, a.k.a. Matt and Storm's house.
Yes.
We're here recording another episode Triggered for you. It seems like the whole world around us is going into a full-fledged panic at this point. Obviously, the coronavirus is on everyone's minds. Last night, President Trump addressed the nation on the coronavirus and what the administration is doing to combat the spread. The president said, quote, "We are marshaling the full power of the federal government and the private sector to protect the American people." And he made some significant steps. He basically banned travel from the European Union to the United States for the next 30 days. The restriction doesn't apply to American citizens, but I assume that if you come back from the European Union, you're going to be screened, and if you have symptoms, you'll be quarantined.
Yep.
It doesn't include the UK, which obviously they're separate from the EU now thanks to Brexit. But the president met with leaders of the health insurance industry, with leaders of hospitals. He said that they're going to waive the co-payments for the coronavirus tests. They're going to extend insurance coverage to cover the treatments and prevent surprise medical billing. They've been cutting the red tape to create antiviral therapies. They've signed into law an $8.3 billion funding bill to help CDC. They're expanding testing capabilities. You know, I get that people want to freak out here because a lot of things have happened in the last 24 hours to kind of signal that this is very serious. And it's good that people are now taking this seriously.
Yeah.
I mean, we've been talking about it here on Triggered for months now.
Yeah.
But the biggest thing is that people need to lessen their personal contact with the outside world.
Yeah.
So working from home. If you can work from home, there's no excuse not to at this point.
Work from home.
Your company should be doing that. We're doing that.
Yeah, yep. Don't go to the movies.
Yeah, don't go to gatherings.
Don't go to gatherings. What gatherings have not been, fan barred or prohibited lately.
New Jersey and New York just put bans on the amount of people that can be in a public gathering right now.
What is it?
In New Jersey,
250?
it's 250, and in New York, it's 500.
I mean,
the New Jersey casinos might close, which is, never happens. Ever.
NASCAR is going to be fanless. March Madness is going to be March Madness might be very well canceled pretty soon. We'll see about that. Big Ten, SEC canceled their tournaments.
The NBA suspended its season.
The NHL recently today suspended the rest of their season, and the MLB is
they postponed opening day, and it's an indefinite suspension essentially.
NFL is the only thing that's still going. Hasn't changed its date, but we'll see what happens.
Well, that's not till
I know, but I'm
late
just
summer. I mean,
but teams, the Giants, the Redskins, they're pulling their staff off the road. So
the Eagles closed their office today.
Yeah, Eagles closed their office.
I mean, if this is still going on in this kind of capacity, by the time football comes around, we've got much bigger problems.
Yeah, this is this is worse. It'll be worse than swine flu, frankly, if it goes on that long, right? I mean,
let's talk about that for a second since you brought that up. So swine flu.
Yeah.
I had a version of the swine flu back in the day, and obviously it wasn't terrible. I didn't obviously die from it.
Yeah.
But a lot of people did die from that.
12,000.
And the panic was nowhere near this.
Yeah. And 60 million were infected.
Right.
So let's and
it was close to 500 million infections globally.
Yeah.
And
it killed over 500,000 people globally.
Right. So keep this in perspective.
Yeah.
It's nowhere near, Ebola or the Spanish flu or anything like that. But in order to lessen the impacts, and the biggest reason to quarantine here and to stay home and lessen your personal contacts is so that we can broaden out the peak of infections here in the country.
Yeah.
Because if everybody gets it all at once and it spreads like wildfire, then the healthcare system can quickly become overrun.
Yeah.
As it has in Italy.
Yeah.
They're now having to decide which patient to treat. So which patient will live and which one will die, which is horrible. And we don't want to reach that threshold where our hospitals can't handle this. So it's good that people are finally, being serious about this and taking these steps. But don't. It's not Ebola unless you're over the age of 50 or even 60 or higher, honestly, or have a very bad pre-existing condition or are immunocompromised. In general, this wouldn't be worse than the flu for you.
Yeah.
Now, it very well could be. You could be that oddity in the data set where something bad happens, which is why I would say stock up, and unless you need to go out, don't go out. I just stocked up on everything, and I basically don't plan to leave the house for the next week or more, depending on what happens. Make sure you have your prescriptions. Make sure you have an adequate supply of non-perishable food. So there's things you can do, be prepared in case you do get sick, have cold medicine on hand. In general, for an average person like us, a regular cold treatment would suffice.
Yeah.
You don't have to expect to be hospitalized or anything like that. But
surprisingly, it's not a very resilient viral infection. I mean, I think Dr. Gupta at CNN.
yeah,
That was actually a very good segment he had before Don Lemon had his meltdown with John Kasich. Was that UV light can kill this virus. It's very, when it gets out into the open, it's easily how do you put it? We can easily kill it.
Yeah.
Its structure is not very sturdy. It can easily collapse.
But
and
if it
dies.
is in a good environment, it can last on surfaces for multiple days, which is one of the biggest concerns.
Yeah.
Is that it's not necessarily aerosol movement with this, where obviously if someone sneezes in your face that has it,
it's the touching of the face and the touching of the other, leading to the touching of the face.
So if you do go out into the public and you're touching things, do not touch your face whatsoever. And a lot of people forget their phones. They're touching their phones constantly. They're touching, things outside, handrails, doorknobs, all this stuff. Disinfect your phones. The best thing to use on that is just like an alcohol wipe, but you can also use Lysol wipes, Clorox wipes, all that stuff as well. You even could douse it in hand sanitizer if you wanted to, if you had a new phone.
Yeah. Also, when using the bathroom after washing your hands, take an extra paper towel and to open the door, or if there's there should be a handicap option.
Yeah.
Hit that handicap button to avoid touching the door handle or anything, because that is, even without Wuhan virus.
Virus, yep.
Even without Wuhan,
we're going to talk more about that.
Running rampant, it's still just a petri dish of bacteria on there, regardless, because people don't wash their hands. I don't know why, but we're still here.
Well, there's a couple side effects of this thing that may actually end up being positive. Yeah. People will have better hygiene. I mean, the fact that people would take it and then not wash their hands is honestly disgusting.
And we've all seen it, so.
Right. But, the other thing here is that people are finally realizing that we can't be dependent on China to produce our medical supplies.
Yeah.
That's been a problem for a long time, is that they are the primary producer of many of the ingredients in our primary drugs and medicine, and they also are the main producer of things like masks and protective medical gowns and all the stuff that doctors are using. People are finally realizing maybe we shouldn't be reliant on another country in a time of a national emergency like this. Yeah. And China can do serious harm to us by not sending these goods through to us and hoarding them for themselves. We have to be self-sufficient.
Yeah, we gotta have a secondary protocol, especially. And Puerto Rico, people were mentioning it's time to restart the pharmaceutical industry there. So
I mean, that'd be a good thing. And we're at the point now where the U.S. is following kind of the same curve as Italy. In as far as infections, and we don't actually know how many infections there are because of the lack of testing, which is a problem.
It is a problem. And also another problem is these colleges releasing these asymptomatic kids back into the general population.
Yeah.
When swine flu was running rampant in 2009, Dickinson College didn't send us home. It was, if you feel sick, stay in your dorm, and the attendance policy will not be enforced that semester. Right. That was basically and the vaccines were being distributed.
Right.
It was not, again, that was when 60 million Americans were infected. We're at a little over 1,000 with 39 dead, and we're like shutting down colleges, among other things.
But it's
just not smart. You want to keep those kids there.
That's real numbers above the confirmed cases are much higher. It's got to be probably close to 10,000 now by this point.
Okay.
And the thing is, you risk risk a doubling though, right?
Yeah, that's true.
So, say we have 10,000 infected today.
Yeah.
Everyone's running around getting all their supplies, right? Then you have more infections. Yeah. It branches. Each person that gets infected can infect 2, 3, 4
That's
people.
True. Yeah.
So you can ramp up really quick. And in a country of almost 350 million people,
all going to the same location to get supplies too.
Right.
Yeah.
We need
I hear you.
We need to basically just quarantine. Everybody needs to try to stay home. The feds already said that they're going to try to do things to relieve the pressure for people who don't have salaried jobs or people who don't have remote, abilities in their jobs.
Hold on.
But the biggest thing is we need to have tests produced.
Yeah.
That's of anything that the Trump administration should be criticized on right now. it's that.
Yeah.
And there's a
Well,
lot of factors that led to that, but we were a little bit behind the ball on
Yeah.
that. You know, the government knew this was coming, and they
we kind of did it a little
they
bit.
did
We
it,
did.
yeah.
Now, Leah wrote this morning, there's a clinic in Cleveland that developed a test for corona. Oh, sorry,
Yes.
Wuhan, that is that can
A
get
swab.
Yeah, it can get results in 2 to 3 days as opposed to 9.
No.
something?
It can get results in 2 to 3 hours as opposed to a couple days.
Hours. Okay, I mixed that up.
Which
I
is
saw
what
that.
we need.
That-
And
yeah, that
we
is-
need
that's
stations.
excellent.
We need stations across the country like they did in South Korea,
Yep.
where it's essentially a drive-up test. You drive up,
Yeah.
they'll swab you, they'll take your information, and a few hours later they'll call you to let you know.
Yeah.
Because if we have infected people going into hospitals and into doctors' offices, it's only going to spread more. So, you know, if you get sick and you're not at high risk, then you should quarantine yourself. You should take cold medicine, and you should contact a doctor, individual, or your Department of Health.
Yeah.
Because at this point, the more you're out and about, and if you go
Yeah.
to hospitals the hospitals, you know, have capacity,
Yeah.
but they don't have everyone coming in at the same exact time capacity.
And that's
what we're trying to avoid here.
Exactly. That's a very good point. If you do have certain symptoms, just like you said, take NyQuil, take simple cold medicine, because you don't want to go into an area where people can potentially expose you to the actual virus if you don't have it. Like
Exactly.
The hospital.
Exactly.
So, you know, it's kind of a double-edged sword here. You know, you want to go to that area, but that could be, you know, filled with infected people.
If you have voluntary doctor appointments coming up, cancel that. Most of those doctors will already be canceling those on you.
Yeah.
But unless it's a life or death matter, don't go into doctors' offices where people could be present with this.
Yeah.
Because that's what's really going to... As long as we can tamp this down within a couple weeks, we can get back to our normal lives.
Yeah.
But we don't... The risk is if we don't change our normal routines, which people don't want to change the routines. I understand that.
Yeah.
But we're past that point now.
Yeah.
And if we don't change our normal routines, it's only going to drag on for months and months and months. And not only is it going to be terrible for the country and terrible for the economy, but it makes people lose trust that the government could do anything.
Yeah.
Right? If there's one purpose of the government, it's for national defense in a situation like this where they have to protect the people of the country. And one thing that Pence has said and Trump has said that I love is that they're focused on protecting Americans first.
Yeah.
They always get asked, well, what are you going to do to help other countries?
Yeah.
Well, we'll do a little bit.
That's
but,
not our fucking problem.
Right. And, you know, but as long as we block those people out from coming here, then that's fine. But we do have to get the global pandemic under control. And what this all goes back to, and a good follow on Twitter for this is Scott Gottlieb. He used to be in the Trump administration, and he knows a lot about this stuff, and they're working very hard in the private sector right now to get the ability to test this stuff in a quick manner.
Yeah.
But, you know, we have to social distance. That's the number one key.
Yeah.
South Korea was able to get it under control because they did this, and they did this earlier than we're doing this. So who knows if it's going to be as effective. But the surge capacity of hospitals is not able to handle millions and millions of people. So that's why we need to go through these tough measures of canceling sporting events and canceling gatherings where that thing can spread like wildfire in order to preserve our healthcare system. Because look at what's happening in Italy.
Yeah.
We don't want that here. We don't want to have to fully lock down the entire country, and we also don't want to have to make death decisions.
Yeah.
The doctors deciding who lives and who dies, it's terrible.
I mean, that's Medicare for all. For all
No,
you,
I know.
For,
That
for,
is
for, for
literally-
all you lefties out there.
Well, not that they're listening
Not that
to
they're
this,
listening, but you know, again,
no, but it's true. If we had a situation like we were all in a Medicare for all system right now, we would be so bad. I mean, if there's one thing other than, you know, the whole manufacturing thing and hygiene that comes out of this, is it shows what terrible results a socialist healthcare system has.
Yeah.
Did you see that Trudeau is potentially self-quarantining because his wife's being tested?
Oh my God.
So, you know, we got to make sure our leaders don't get this. I'm glad that
Yeah.
Trump canceled all of his travel and is going to be at the White House.
Yeah.
They should minimize his contact because, you know, we can't have our senior leaders getting this.
No.
Because that wouldn't instill
I
confidence.
mean, the UK health minister was tested positive recently, and then didn't you say last night the Italian manager, like the Wuhan virus manager, died?
Yes, the
Oh my
Italian
God, yeah.
health chief did
Yeah.
pass away. He was 67 years old, and
Yeah.
he got it, and he died. And, you know, this virus is very rough for older age
Yes.
groups, people that have pre-compromised immune systems and things like high blood pressure or cancer or diabetes or anything like that, it really, it could take them down quickly. So, and Scott Gottlieb said, we'll get through this. It'll end. We have some hard months ahead of us, and we're going to have to sacrifice some of normal life to reduce the severity of what's ahead. And that's the big key here, is that people need to wrap their head around, you're not going to be able to take, vacations. You're not going to be able to do everything you want to do. But in the interest of the nation here, these are the tough things that need to be done. And
a couple of weeks changing your routine is not going to kill you. So.
Right. So we're finally doing the things I think we need to be doing, and it's a good thing. But at the same time, you have pieces of like Jim Acosta. And last night, Jim Acosta, immediately after the president gave his speech, goes on CNN and essentially says that, well, let's listen to this clip and then we'll talk about it.
Yeah. The other thing, Chris, that I think we should point out, at one point during this address, the president referred to the coronavirus as a, quote, foreign virus. That I think was interesting because, as I was talking to sources earlier this evening, one of the points that the president wanted to make tonight, wanted to get across to Americans, is that this virus did not start here, but that they're dealing with it. Now, why the president would go as far as to describe it as a foreign virus, that is something we'll also be asking questions about. But it should be pointed out that Stephen Miller, who is an immigration hardliner who advises the president, is one of his top domestic policy advisors and speechwriters, was a driving force in writing this speech. And I think it's going to come across to a lot of Americans as smacking of xenophobia, to use that kind of term in this speech, Chris.
I mean, that's unbelievable.
It's ridiculous. He comes on and he says that quote, smacking of xenophobia.
Ugh.
Because Trump said it's, quote, a foreign virus.
Well, did it originate in Kansas, Storm?
Right.
Did it?
Let's check the facts, right? Yeah. So, where did the virus originate? Wuhan, which is in China. And then the Chinese lied about it for nearly a month before they couldn't lie about it anymore and needed assistance from the world, essentially. And then they let it get loose, and it traveled across the world from place to place, went to Japan and South Korea, Europe. There are some cases in Africa, the Middle East. Then from Europe, that's how it initially made its transport here, was people who went to Europe, places like Italy especially, because Italy is a popular tourist destination for the U.S.
Yeah.
And they came back, and they were asymptomatic, they didn't know, and they were spreading that.
Yeah.
And now we're at this point where we essentially have to shut down the country to get this under control.
Yeah.
All because of these Chinese. And it's ironic that the NBA had to cancel its season because, they're the number one Chinese defenders.
They love China.
And it's the Wuhan virus. Yeah. They're trying to whitewash this.
I know. The Wu flu.
Did you see what the Chinese ambassador tweeted? He essentially inferred that we created the virus and then released it in their country.
I think that's the opposite. That's called projecting everyone.
No, I know. I mean, it's just absurd. It's absurd. And, if you look at the definition of xenophobia, right, which is a ridiculous word to begin with. I don't buy into that bullshit. But if you look at the definition, it's an irrational fear of something foreign, right?
Yeah.
So is he saying that our fear of the virus is irrational? Because he's the one going on CNN every single day saying, oh, this is serious. It's like Ebola. We need to lock down the country. Yeah. Trump needs to do something. It's just unbelievable.
Yeah, it's ridiculous.
It's totally unbelievable.
I mean, sometimes you just can't make it up.
He's a piece of shit.
Yeah.
And, all they could do last night on CNN was criticize the president. Yeah. And the president said, we need to put politics aside in this situation because this is something that can affect you whether you're a Republican or a Democrat.
Yeah.
So politics shouldn't have anything to do with this. Congress can't get their heads out of their asses with coming together on some sort of package of tax relief, financial relief for businesses that are going to be hurt by this. Good thing President Trump last night, he made some small business loans available so that small businesses...
Well, there's going to be a whole lot more You see that like $1.5 trillion is being ready to inject into the bond market to keep it steady.
They need to inject the liquidity because otherwise people are going to hoard the money.
Yeah.
That's the whole point,
exactly,
right?
Yeah.
And small businesses have payrolls to meet. He extended the tax deadlines for a lot of businesses, which is a good thing. And and they're also probably going to extend the tax deadline for individuals.
Yeah.
I mean, the next month period from now up until about April 15th is going to be tough.
Yeah.
It's going to be tough in this country. And people need to, I think, mentally prepare, because the niceties of the freedom of America for a little bit are going to be limited.
Yeah.
I mean, that's just a realistic view of where we're at.
Blame China.
And it is China's fault.
It is. I mean, honestly.
And there's, well, that's racist. Well, I don't even give it, honestly.
Just because, I mean, well,
I've been getting called racist by people because, I don't like illegals coming into the country and all that for years. So,
I know.
Remember
George
Mason.
Yeah. They booted you from the council.
Yeah, and they closed down George Mason. So is that racist?
Yeah.
Because the Wuhan virus is on the loose.
Yep.
Like, and someone called it the Wu flu.
The Wu flu.
Which was a good one, I thought.
Kung Fu flu.
Yeah, I mean, it's, at this point, we're where we are, and, people are catching it.
Yeah.
Tom Hanks has it.
Yeah.
He's in Australia, which, little concerning.
Wilson!
It's a little concerning because we were hoping that with warmth, the virus would sort of die, but it's summer in Australia, so we can't necessarily rely on that as a backstop to this. We need to crush it ourselves.
Yeah.
One of the press aides for President Bolsonaro in Brazil has it, and President Trump was just with them over the weekend. So I'm saying President Trump needs to be like at the White House.
Yeah,
he can't be seeing random people. Like, they need to just basically
isolate him. They need to shut down for the next month or so.
Yeah. And President Trump, when he was asked about it, said, let's put it this way, I'm not concerned. And, of course, he's not going to say, well, yeah, I'm worried.
Exactly.
But you could tell last night that he was nervous. And it's very clear that he's now taking this seriously. And, I wish we had gotten like a 2-week head start on this, but we didn't. And now we're where we are. But they're rolling back regulations that are preventing testing from coming to market. So, this is basically where we're at. And luckily, we'll still be able to release Triggered to you for as long as, the Townhall offices are shut down. We'll still be recording here at our house.
Yeah.
Maybe we'll even record some videos and post them to Twitter. But, we're
bunker.
We're here. We're in the bunker, and we basically just need to, as a country, be united. In this fight against the virus. And
agreed. And I wish I could think that would come of this, but we all know that the Democrats going to attack Trump.
Well, look at what the media is doing.
They can't do it. I mean, they know that if they come together, it's a win for the president, and then that means he's going. He's already on re-election track right now, and this is it.
Well, the problem is
Joe Biden looks like a senile old Alzheimer's patient out there.
Well, let me tell you,
they
better put Joe Biden in like a case.
Agreed. Yeah.
One of those barometric tubes.
Both of them. Because Bernie's soldiering on too. But it's been buried because of the Wuhan virus. But Joe Biden has had some moments on the trail that does not look good. But
he's gonna have that for a long time.
Yeah.
Now they could use this as an excuse for him not to really do anything.
Yeah.
They're gonna have the debate on Sunday though, which is gonna be interesting.
Which makes no sense because they're moving from Arizona to D.C. because of the Wuhan virus.
So that they don't have to fly. They're already here.
Oh, they're already. Oh, okay. Yeah. That's what okay. That's what I'm saying. Like Wu flu is here.
Yeah. Well, they're not gonna have any crowd. So there's not going to be anyone else, which will be interesting because it's going to be silent.
Yeah.
So
silent debate.
Yeah. I don't know if they're going to be sitting or standing. Joe was requesting sitting.
Well,
we had the elections the other night. Joe Biden swept as we anticipated. I mean, Bernie won North Dakota and
just
whatever.
Dominant. But Joe won every county in Michigan.
Joe has essentially, if we're putting a percentage on this, Bernie has like a 1% shot.
Yeah.
And it's not even that he has a 1% shot
I would say even less than that.
It's not that he has a 1% at getting the delegates, but he could stop him from getting to the threshold.
Yeah.
Which, even so, if Biden has a plurality going into the convention, they're going to give it to him.
Yeah.
So, it's going to be interesting.
What a turnaround. We went from, besides Biden being toast, the other narrative of, is this going to be a contested convention is now totally dead. In the span of a week. Which sucks, because I wanted that to happen.
Well, what's really interesting is Joe Biden didn't necessarily earn those votes. And this was said by Nomiki Konst on Fox.
Oh,
and I hate her.
Yeah.
I fucking despise her. But it was a valid analysis that she gave, that Joe Biden hasn't earned these votes. Those were given to him by the establishment.
Yeah.
Right? So,
because he really didn't go up to Michigan, by the way.
Right.
Yeah.
So if you look at this, there is a possibility that this debate, Biden looks terrible, right?
Well, yeah.
Say he looks absolutely horrible.
Well, we discussed, 2 hours of gaff-tastic Biden could mean you never know.
Right. So
I mean, it is 2 hours, right? If it's 3 hours, dear God. Dear God.
Also, what if something happens? I mean, it was kind of smart of Bernie to stay in the race.
Yeah.
Definitely self-interest there for sure on his part. But he sees a slight opening that if something were to happen, he could possibly capitalize on it. But at the end of the day, his movement has won the ideological debate on the left.
Yeah.
They're all socialists now.
Yeah, pretty much.
So
Yeah,
even
on
though
healthcare,
Bernie may be close to being defeated, we still haven't defeated socialism because the whole party is socialist.
Exactly. And it's in his name. I mean, remember, Bernie's a revolutionary. He wants total upheaval of the system. He wants left-wing revolutionary politics. Those people, I mean, like Che Guevara, they fight to the death. They don't care about the delegates or the math, although they should. But it's all about the movement and
we'll see.
We'll see what happens. But
the debate should be interesting on Sunday.
I don't see him again. I mean, it may not be. I just don't see a marriage between those two groups.
Right.
I think yes, they're united in defeating Trump, but one side is looking generations ahead at healthcare. The progressives, and if Biden might be a Democrat, but if it's just a Democrat version of the current system, then why are they going to vote for that? What's exciting about that? You saw that in that CNN panel during the election analysis. I mean, the Sanders people on that panel are just not. I'm sorry, they're not going to, I think, go into that Biden train. And the Biden people, they're all egotistical, like most people in this town. They're gloating. They're not going to reach out the way that these progressives would like them to reach out. In terms of healthcare and stuff, and promising certain aspects of their agenda. I think it's going to be a disaster. And you have Joe Biden quarterbacking this whole thing. Like, I just don't see it. I just don't see it. But
yeah, I saw a meme the other day that was a Mad Men the meme where John Hamm is pitching, right? And he's like, okay, so we're gonna rerun the campaign that Hillary did, but with an old man riddled with dementia. How does that sound? I mean, it's going to be interesting to see what happens, but the response to this coronavirus is going to play a huge role in the election. It's going to play a huge role, and President Trump needs to do a good job with this because I think that this, and it sounds very politically, I don't know, terrible to say. It's a terrible thing to say, right? To talk about politics with this, but this is a bigger threat to the Trump presidency and re-election than impeachment ever was.
I would agree with that.
This has an ability to potentially destroy people's trust in him. So he needs to do a really good job.
Right now, people's 401ks have been wiped out. Yeah. So trillions have been removed from the market. Not wiped out, removed. Money has just moved, That's another thing that our boss says. It's not wiped out, it's just removed from the market.
Just temporarily gone.
Temporarily gone, which is true.
Well, here's the other thing, right?
And people feel that, unlike the impeachment nonsense. So, I mean, this is...
The thing is, the market's eventually going to come back.
Yeah.
It will come back, and it may keep dropping. Nobody knows where the bottom's going to be. But once this threat of the virus passes...
Scares me, by the way.
Right.
Remember in 2008? Well, we'll see how the bottom almost came out.
Right.
Like, we almost didn't have money spitting out cash out of the ATM.
I think that President Trump should think about halting trading starting Monday.
Well, after today? Oh, my God.
Well, what's going to happen tomorrow? Worse. It's going to be worse. I think he should look at halting trading because, one, you don't want all those people on the stock exchange anyway. But then you look at people and say, well, that could cause more of a panic because they can't access their funds. So who knows? I mean, who knows what the right move is here, right? Everyone plays armchair president and they say, oh, you should do this, and this. But nobody knows until you actually have to make that decision.
Yeah.
And that's what the left's been doing. MSDNC and CNN's been doing this for days now where they say, oh, President Trump should do this and this and this.
And I guarantee you, every single one of their proposals in real life, there would be 15, maybe more opinions saying why you shouldn't do that because of X, Y, and Z in the international markets and so on and so forth. So exactly, like you said, armchair presidency.
No, that's what it is.
It's ridiculous. I know it is.
I think that more should be done.
Yeah.
But what I think should be done are very drastic steps.
Yeah.
I think that they should close off all international entries to all countries. They should only let U.S. citizens back in after rigorous testing.
Yep.
And they should also, and this is a big one,
Yeah.
shut down all commercial air travel.
Oh.
Which is huge. Hasn't been done since 9/11.
Yeah,
but if we really want to be serious about
Yeah.
stopping this spread,
Yeah.
we're going to need to do something drastic like that, because
Yeah.
the real problem here is people don't even know that they're sick.
Yep.
The asymptomatic carrier can get on a plane, not have any idea that
And
they've been
infect the whole
exposed or
plane,
sick.
infect the whole plane.
Right. And then those people, they lay over in Chicago,
Yeah.
they go to LAX, they
Yeah.
fly down to Denver, they go to Dallas, they go to
Yeah.
Florida. It just spreads all over the country. Air travel, the Spanish flu was before air travel was
Yeah.
even invented.
And it killed, what,
So-
like a fifth of the population?
Right. So
Something like that?
And this doesn't have the lethality of that.
No.
But it is, according to the numbers now, and I think these numbers are probably overinflated because not all of the cases are being reported. But according to Dr. Anthony Fauci, who's basically the medical doctor that's in charge of a lot of this, and he's absolutely to be trusted, he's very good. He says that it's about 10 times deadlier than the seasonal flu, which is accurate based on the numbers we have. Now, we also don't know if we have accurate numbers from China, right? In Iran, we definitely don't have active numbers because satellites showed this morning that they're digging mass graves and dumping bodies in them.
Oh, jeez.
So we don't know what the numbers actually are. It's certainly deadlier than the average flu. It's definitely the talking point of it's just the flu is not accurate at this point. Now, if you're under 50 years old and you have no underlying health conditions, it's not going to necessarily be a threat to your life. Now, you may get sick, you may have a miserable time, you're likely not to die from it. But if you're over 50 and you have underlying health concerns, or if you have someone, a grandparent in a nursing home, or you are immunocompromised, it's a threat. You should take it seriously.
Yeah.
And the people our age, right, should also have to take it seriously because we can transmit it to people.
Yeah.
That's the bigger issue.
We're,
right?
we're the delivery vehicles.
Right,
pretty much.
right. You don't
Yeah.
want to end up, killing
Yeah.
someone in your family
Yeah.
because you were careless.
Yeah.
So,
which is, by the way, we talked about that Washington nursing home. That's how they all got it, and that's how the deaths began. Is because someone who was asymptomatic reportedly went in there,
Right.
and it spread
Right.
like a brush fire. So that's the type of. That's why we say limit your contact. Maybe not have friends over. I know it's a killer. The weather's getting warmer. It's nicer out. You want to light up that barbecue and have everybody over. You got to put a hold of that right now. Put a hold of that right now.
yeah. Definitely
I
don't.
know it sucks, but you just gotta for a couple
we
weeks.
were gonna have a debate watch party here at
Yeah.
our house, but we're not gonna do
No,
that. You just
no,
gotta
no,
take it
no,
easy.
no.
Just take it easy.
No.
And it sucks to sit at home by yourself, but it's the safest thing to do at this point.
Yeah, I don't feel like getting sick, and I don't feel like getting other people sick.
Well,
so.
I'm a germaphobe when there's not going on.
Yeah, and we keep this
So-
house very clean. We keep this house very, very clean.
Yeah, no, we're fine. I'm just
Yeah.
saying, like in general, this stuff kills me because I hate germs to begin with.
I
When I
know.
get on a plane when there's not a pandemic, I'm
know.
like, oh, who's coughing? And give them
Yeah.
a death stare. So,
You probably died when the doggo had the diarrhea in the kitchen.
oh, that was terrible. That was, as Trump would say, that's my personal Vietnam. But to end the show here, as we've been saying for months and talking about this well before others, right? I've had a couple people message me to say, "Wow, you guys were like months ahead of everybody else on this."
Yeah.
Stock up on supplies, go to the grocery store, get yourself some non-perishable food, get yourself some food for at least like the next week.
And water.
Water.
Lots of water.
Make sure you have if you take medication, make sure you have your prescriptions. Get some cold medicines in case you do end up getting the Wuhan flu,
Yeah.
or even just a regular cold.
Tamiflu.
The regular flu is still going on around
Yeah.
out there right now. The medicines to hit this with are Robitussin, Dayquil, NyQuil, and then
Yeah.
you can take Mucinex. But the thing is that you're not the symptoms with this, you're not getting a head congestion. It's
Yeah.
just going right for your lungs.
Yeah. Anything
And-
that helps with the chest.
Yeah, and then also Tylenol's
Tylenol's-
congestion,
yeah,
chest.
Tylenol's good.
But another tip I got from a nurse this morning was make sure you're drinking a ton of water, because if you are exposed, it's going to attack your throat first and then move down into your lungs. So if you do that, you can potentially wash any virus down into your stomach, which of course the acid will kill it essentially.
yeah.
So there's ways to avoid this.
Well,
Hand sanitizer.
I drink a shit ton of water every day. So.
Yeah, you almost drink too much water. I mean, I can't do that. I'd be pissing 55 times
Yeah.
a day.
I drink about a
But-
gallon a day.
Yeah. So do what you normally would do. Work from home, obviously, if you
Yes.
can. If you have the option to remote work, you absolutely should be doing so. And encourage your companies to do that as well if they're not
Yeah.
yet. And if you do go out, the mask is not really going to save you. The mask is not necessary, but don't touch your face. Certainly do not
For
touch
God's
your
sakes,
face.
don't touch. Yeah,
And
don't.
I bought a box of medical gloves.
Which is why
so
the masks are a bad idea, because
Yeah.
people are touching their face constantly trying to adjust that.
if anything, get yourself some medical gloves. And
Yeah.
don't pull your phone out while you're outside.
Yeah.
And make sure to use hand sanitizer if you can. If you don't have hand sanitizer already, you're not going to find it anywhere. But what you can do is you can take a little bottle of rubbing alcohol with you. That works just as well. So, we're going to be in this all together, and it's going to be a rough couple weeks. There's no sugarcoating that. But,
Nope.
we have to do this as a country, and hopefully, as President Trump said last night, people can put the politics aside and work together as a country to beat this, because that's really what's going to have to happen here. And Don Lemon last night, oh my God.
Oh
Yeah.
my Lord.
It was unbelievable.
Yeah.
Just
Basically-
search Don Lemon,
Yeah.
John Kasich,
Yeah,
and
John Kasich wouldn't bash Trump's address, and
Right.
Don Lemon had just blew a gasket.
And I am
so.
no John Kasich fan, but he was
No.
in the right. He's
Yeah.
like, the president's tone was correct.
And he was serious.
Yeah.
And he showed initiative. And then Don Lemon just couldn't handle it.
Yeah.
So
So of
enjoy.
course,
That's some good popcorn.
we'll
content
be
right there.
we'll be very active on Twitter, of course. My handle is @storm_Paglia, and Matt's is
At real Donald Trump.
yeah. What are you at mvespa1?
Vespa1.
Yeah, and of course @triggered THM is our Triggered podcast account. We'll definitely be tweeting on there for you. Feel free to send us messages, emails, triggered@townhall.com. We'll be sure to get back to your emails. We're around. We're here.
Yeah.
We'll probably have some more free time on our hands now.
Yeah.
So we'll be back here for another episode of Triggered on Tuesday. Maybe earlier. We'll see.
We'll
we
see.
might have some more free time now. So
50-50.
yeah, 50-50. We
Yeah.
have an episode on Monday.
Yeah.
Get your popcorn ready for the debate on Sunday, if it's still on by then.
Still,
Who
we'll see
knows?
what happens.
But thanks a lot for listening to Triggered, and we'll see you next week.
Be safe out there.